Let's begin the first podcast for this year, Shrutika. So, you're Dr. Shrutika. For the audience here to know, tell us who you are, what you do, and where are you from?
Okay. So I'm Dr. Shrutika Itkelwar. I'm a dentist by profession. I now have 18 years of work experience. I head Dentinix, a multispeciality dental clinic on Sajapur Road. I did my graduation from Chhattisgarh, and I did my fellowship in implantology from United States of America. And I'm basically from Nagpur.
Okay. So, when you say you did your master's from America, right?
Fellowship in implantology.
Okay. Uh, why you chose to be a dentist? Is there any particular reason you decided from your did you decide it from your childhood that you wanted to pursue this profession, or this happened accidentally like most of us?
Yes, like most of us, it happened accidentally. I gave a exam for medical. I got selected in Indore Medical College, and the state got divided. That's how I ended up in the only college in Chhattisgarh, which is a dental college.
That's how
Yeah.
you
Went
made
ahead.
this as your profession,
Yes.
right? Okay, so about your profession, if I have to ask you, what's the toughest part of being a dentist?
Um, Toughest part of being a dentist is, people do come in pain, and to convince them that the dental procedures are not that painful and you will get rid of the pain is the most toughest thing. Convincing people to pursue treatment.
Okay, I've often heard within my family or within my friend circle that usually a doctor is always paired to a doctor in his family life, right? A husband, wife are doctor, that way. But as I know you and your family as well, I know your husband is not a doctor. Uh, do you find any challenges with it? Or does he find any challenges?
No, we absolutely love not being a doctor couple because initial days of my college, I wanted to marry a doctor, but my father had a vision key. Both the doctors, both will struggle. So let's get you married to an engineer who will be settled. It started like that, and no, we're very, very, very happy that we don't bring our work to our home, and it's a very balanced work life.
Okay, interesting, interesting. So, fine. Uh, just a bit of a fun question. Do you guys judge people based on the color of their teeth?
Oh, yes, absolutely. We do judge people by color of their teeth. And that's the first thing I notice, not the eyes but definitely how their teeth are.
And being in the profession you are practicing since 20 years is what you said. Do you get very weird patients and weird requests? Do you must I'm sure you must be getting something. Do you remember such incident where you have got a weirdest request or weirdest thing from your uh, patient, I would say, which you found it to be funny and weird at the same time?
Um, Not weirdest, but a lot of people think, can you connect me to gynec? A lot of time they say, can you connect me to gynec? Can you connect me to cardiac? So a lot of time they ask me to connect to the other doctors. Not weirdest, but yeah, this is what I get.
Okay, so maybe a female doctor, they maybe associate you
Yeah.
with a gynecologist.
Yes.
Okay, interesting. Uh, as a dentist yourself, do you also go to a dentist for yourself?
Yeah, I do go to a dentist myself. As the fun part, I have 8 cavities. I fill my teeth with another dentist, and I do a regular cleaning and a checkup in 8 months.
Do you pay for that?
Uh,
Okay,
no.
that was not a part of the question. Yes. And when you say to normal patients, I mean, I remember my dentist telling me that every 6 months you should visit a dentist.
Yeah.
Whether you have any problem or not, you should regularly visit.
Yeah.
As a dentist by yourself, do you also visit a dentist every 6 months?
Yeah,
Be honest.
yes, I do in 8 months, 8 to 10 months. I have my colleague. Definitely, I do not do my treatment in my own clinic. So I'm bored of going there every day. So I go to my colleague's clinic for dental checkup. Yes, I do.
Interesting. Uh, there are a lot of companies these days uh, on Instagram where the ads keep popping up whether it's Invisalign and a dentist at home where some technician comes, he puts electronic scanner inside your mouth, and they are not dentists, especially, I mean, the people who come. Do you find how do you see that? Is it a competition to you, or is it uh, uh, some innovation that's coming in your industry, or how do you see that? Because this is all tech based, Instagram focused marketing practices that has been done in your profession. So how do you see it?
Right. So I'll see it in a two ways. First way is a good part. Companies like XYZ have gone home and made people aware that something like the scanners and aligners are there. So they have made aligners much, much popular. Now everybody knows about aligners. The bad part is the treatment part is not good. So the treatment failures are higher, which in turn making the patients come back to us and get the treatment done. So it has helped us more than disadvantage.
Yeah, of course, that's a natural progression of any industry, I would say, when the technology gets integrated. The initial, I think, initial few years, there is a resistance, but then automatically it gets integrated with the real profession. Absolutely. Given an option to you, I see a lot of my dentist friends these days, suggesting Invisalign, I mean, those, against braces, which was very traditional few years back. If given an option for you, for your patient, whether braces or Invisalign, what do you recommend? I feel as a customer or as a patient sometime that do doctors these days or do dentists these days recommend Invisalign only because it costs more and possibly and probably that's the business around it, or it's specific to some patients, whereas braces, the traditional old method, does wonders for all.
So braces have also traveled a long way. There are no more traditional braces. We have invisible braces. We have pain-free braces. But yeah, the culture of Invisalign has become more because they are not they're transparent. You can eat anything which you want to. They are more comfortable. And no, all the cases are not for Invisalign. All the cases are not for invisible braces. There are certain cases which we have to divert. But the demand of Invisalign have become higher. And money part, of course, money is one portion, but when it comes to comfort, the patients are choosing aligners more than the braces.
Okay, and is it Invisalign or braces? Is it a fad in uh, the rich society of our country? Because I don't find people from the lower strata, correct me if I'm wrong, doing the what do you call a smile correction and all this thing. So is it only restricted to someone who has a lot of money? Do you think that's
No, it's not actually. Yeah, you can say some part because people who are in the business or who are facing people, they want to correct their smile better. No? They want to look good. So definitely 70-80% probably those people are doing this Invisalign and braces and they can afford. But there are also colleges, government colleges, where the treatments are also done by the studying doctors. The equally infiltrated, even those starters equally infiltrated. People are doing braces.
I feel dentistry as a profession, uh, from again the customer or the patient side of this side of the table, looks like a very costly industry, right? Compared to a general physician where you go and you pay 100, 200, maybe 500 rupees and take a prescription and take medicines. Whereas dentistry is perceived to be a very costly affair, and hence I think a lot of people hesitate to go to a dentist. Is this a myth or is it a reality?
In general, dental treatments are expensive. Good dental treatments are expensive. But as I said, there are stages. If you go in stage 1, a simple filling would cost you around 2,000. You go in stage 2, it might cost 4. In stage 3, a root canal or a capping comes, which might range from 15 to 20,000 depending on the dentist. But if you go in stage 4, it might go to an implant which can cost you 40,000. You have to decide which stage you want to go to a dentist and how much you want to spend. So dentistry is not expensive. The late coming to the dentistry is expensive.
I think that's true for all any kind of diseases. Yeah.
Overall, yes.
Uh, are there any studies which relate uh, a patient not treating his teeth or not taking care of his oral health, uh, you know, leading to a very different disease altogether, whether it's a heart problem or something related to liver or kidney? I've read somewhere where because of the oral health was not maintained, it affected the other organs. So is it true, or it's just a Google gyan?
No, no, it is not a Google Gyan. There are certain studies which say that there are bacteria in the mouth which can actually cause certain heart diseases. Matlab they would be responsible for initiating the other bacteria for the diseases. Not most of the organs, some of the organs.
So now coming to this modern way of oral care, which is about mouthwash, about n number of toothpaste in the market. Do you think it's more of a marketing thing that these companies are doing, or do you really think it's worth spending this much money in getting those, what these days, those wooden brushes, electric brushes, and whatnot? Do you think, or a simple care does same what this everything does?
In this regard, I'm a very old school. I feel using a normal toothbrush twice a day and rinsing after every meal probably is more than necessary to do that. You don't have to go with electric brushes or mouthwash, extensive use of it. A simple brushing twice a day, rinsing after your food should help, and visiting your dentist every 6 months. Simple, keep it simple.
The oral health, what are some foods that you would say are worst for oral health or worst for teeth? We have been listening from our childhood that chocolates are not good for teeth. However, I see someone saying after eating chocolate, you just brush your teeth and it's absolutely fine. I don't know. What are those worst food for teeth?
Anything which sticks to your teeth are worst. Chocolates, any sugar candies. In fact, excessive use of lemon also can cause the teeth to get abraded. People have a lot of spicy, this citrus fruits or pickles that can also in turn harm the tooth. Cigarette smoking is something which really harms the tooth. They take away your upper layer of enamel, and sensitivity can start. So,
Okay. And these are considering chocolate versus sugar candies. Which is more harmful, according to both? Okay. So for kids, I think.
you should see. I have a fund of doing in my clinic. Some patient told me, don't take away, childhood memories from a kid by stopping him to eat a chocolate. I said, eat on a chocolate. My favorite day is a Sunday. Eat a chocolate on a Sunday and then brush.
Okay.
That way we can tell them, once a week, any sugar candies or anything is okay. One, a chocolate in a moderation, but do brush post that. That can be done.
That can be done. Okay. So eating chocolate might not be harmful if you take care of your teeth.
Yes, in
Right?
moderation.
In moderation. Of course, that stands true for everything. Uh, is there, like you said, these are worst foods for teeth. What are those good food for teeth? Like something that you should chew on regular basis, which would maybe help you improve your oral health. I've heard about betel nuts. A lot of people say you eat pan. Most of the time, I see those red stained teeth of a lot of people, and they say it's good. That's why we eat.
No, there are certain things which are myth, like betel nut, pan. They're actually going to abrade your teeth. So they're not at all good for your teeth. They're good for your digestion, probably not for your teeth. Also, a lot of people use those, I don't know what to call it in English, some fitkery or something. They keep it and then say alum. So, our teeth are going to be nicer, the stains are going to go. But in turn, they all are harming your teeth in a counterpart. So that's not correct. If you really want to keep your teeth healthy, I think any food is okay. For that's it. Any healthy food is okay.
What's your take on fluoride? I mean, the fluoride in toothpaste or sometimes even in water.
Yeah.
Some say it's good for your the oral health. Some says it's not good. What's your take on that as a dentist?
If fluoride in any form, either it's in a lower form, it helps the teeth to become stronger and fight against the bacterias. But if you ingest, intake the water with excessive fluoride, it can cause the teeth to become more brittle. So that condition is known as fluorosis. You can see red and white patches in so many people. By birth, those are fluorosis stains, and the teeth become more brittle to breakages. So excessive fluoride in water is not good. But in areas where the fluoride is lesser, the fluoride in minimal amount can make your teeth stronger. So they both goes different ways.
Who decides or who will tell us whether uh, this amount of fluoride is good or bad for your teeth?
And nowadays, we all are having RO waters. So all the fluorides are being controlled. There are certain states where the underground water has fluoride, which is some parts of Andhra, some parts of Maharashtra, Latur, some parts of Orissa. They have excessive fluoride already told by the government that these areas have more fluoride water. And you find fluorosis patients more from that area, Rajasthan for that sake also.
Interesting. So again, the same thing. If it's in excess, anything is consumed in excess quantity, it ruins your health. Okay. Uh, Probably we are the only species who first uh, who tries to find a problem to a solution, right? Uh, none of the living species uh, brush their teeth, right? Whether it's any of the mammals, of course, no one brushes the teeth. Do you think we, as a race or human beings, have actually uh, overdone all these things to an extent that oral health or maybe dentistry as a profession has evolved out of it?
For that sake, everything has evolved. We never had a childbirth problem, but now we have multiple gynecologists doing IVFs and treating people. So the lifestyle from past many years have changed. We used to have healthy food, more and more vegetables. So the need of a dentist earlier was lesser as compared to what we are eating now. We are eating junk food, what the kids are eating in their birthday parties, the cakes, the pastries, everything is harming the tooth in turn. So the lifestyle has changed, and that's why the need of more and more dentists. For that sake, more and more doctors in all the field. We never heard of cancer. We never heard of so many cardiac diseases which we have now. So overall lifestyle has infiltrated in dentistry also.
Uh, there's a trend which during our childhood we have never heard. I mean, you as a dentist, of course, must have seen it, but then we never heard about flossing.
Right.
Do you think that it's needed now, or it's just a trend? A, a solution looking for a problem.
Again, I'm an old school. I feel that if some food is getting stuck and there is no cavity, a gentle flossing is okay. But a lot of time people do have not, are not aware of how to floss, and in turn they start aggressive flossing, creating an extra gap which was not there or not needed. So, if a proper technique of flossing is followed, yes, you can do flossing at bedtime in the areas where the food are getting stuck. But if you do not know, it's gonna harm the gums, abrade the gums more rather than giving you a benefit. So proper technique is important.
There's a recent trend of which I keep seeing on Instagram about oil pulling. What is that? Is it just an Instagram trend? But then I've seen some big companies having that oil pulling. I don't know whether you call it medicine or whether it's alternative to a toothpaste or what it is. But then do you find that a new trend, or did it exist from early days?
It did exist from early days, but the problems were smaller. Now the dental problems are bigger. It's not going to help people in the longer run. You still have to go and see a dentist.
Uh, we often believe that when there is a Ayurveda term associated with certain products, those are traditional and may not harm our body, right? And that's where I remember during our childhood we used to have a yellow color box of a dant manjan, red, yellow, which still exist. Uh, do you think that there is a relevance of that product today, or you think that you know toothpaste, the Colgates and Pepsodents of the world, are the ones those are helpful for today's food habits?
See, if you go back some decades back, Ayurveda was pure. Now, I don't think Ayurveda exists in that purest form because we are not getting so such purest form of herbs also. It's everything has become commercialized. So, are they good and are these people, are others bad? No. Both have their disadvantages and advantages. I think now the Ayurveda products are not that pure, so I will not probably I don't recommend much, and still feel the Colgate and Pepsodents are doing better job at saving the cavities.
There is a recent trend I've seen that there is a terminology called as a smile correction. I see a lot of my friends who are about to get married are going for it. Do you really think uh, a doctor can correct a smile? And I have seen people spending lakhs to correct the smile. Uh, is it again a trend, or does it really help? Does it stay for long? And what's your say on that?
It really helps. See, nowadays everything is about how you carry yourself, how you look. You're spending so much of time in wearing a good clothes and spending so much on your weddings and photography. Imagine you don't have a good smile, and you're covering your face, and how the photographs gonna be. So definitely for a bride the smile is important, and for that sake even the models or who are in the industry where they have to face people, smile correction works amazing. It boosts up the confidence also of the people. So yes, it does last longer. There are certain things called as laminate, veneers, crowns, which can help these people to correct their smile, build their confidence, make them more prettier, and
But then
smile
again,
brighter.
this is restricted to that affluent
Yes. Yes.
society.
Yes, it is restricted to them because they are more conscious about how they look, rather than people who are still trying to chew their food.
Absolutely. So thank you, Shrutika, again for
Thank you so
answering
much.
that. Thanks for coming. Thank
Thank
you.
you.